right, we'll go ahead and get started. I know Leah has a lot of information to go through, so I don't want to run her out of time. Thank you all for joining us. My name is Beth Ayers. I'm the Executive Director of Family Peers for Hope. Welcome to Family First Wednesdays. This is a monthly webinar for family peer supporters and families raising children with special health care needs and/or behavioral health challenges. Family Peers for Hope is a newly formed family-run 501(c)(3) with a mission to lead the development and expansion of family peer support in Montana, providing hope, empowering families, building connections, and inspiring change. Welcome, everybody. Feel free to turn your cameras on if you can. It's always nice to see your faces and feels a little more interactive. We will have time at the end for questions. So at that point, feel free to unmute. So I'd like to introduce you guys to Leah. She is the founder and executive director of Incubrighter, and she is the creator of Traces, which is a screening tool designed specifically to identify signs of trauma activation in caregivers of multi-system involved youth, which here in Montana, we've been referring to that population as children with special health care needs and/or behavioral health challenges, or children with complex care needs. I don't want to get too far into traces. I'll let Leah do all that, but I just want to say that when I heard about this and when I saw this presentation, I felt more validated as a family member than I ever have. And it just really resonated with me. And I think that this screening tool will just help really validate so many families and help us to really bring attention to those of us that are parents and caregivers. So with that, I will turn it over to Leah. Thanks, Leah, for being here.
Thanks, Beth. I really appreciate you having me. I am going to go ahead and share my screen so you guys can see my presentation. Can everybody see it okay?
Yes.
Yes. Okay. So, like Beth said, my name is Leah Busick. I am the founder and executive director of Incubrighter, and my specialization is in nonprofit capacity building and research that helps guide nonprofits in data-driven decisions. And part of that has to do with traces. Sorry, I got a little lost. And that's what I'm here to talk to you guys about today is traces. And traces, it stands for trauma and relational adversity in caregiving environments. So before we get really into the meat of my presentation, I'd like to take some time to get to know you. So if you would share your name, how long you've been a family peer supporter, and our icebreaker question is, what is your life motto? So if anybody would like to kick us off, I would appreciate it.
I can go ahead and start. My name is Linnea Wallace. I am the president of Family Peers for Hope and a parent to two autistic children working in the community here in Billings. And so I am not a family peer supporter, but I have been kind of a part of this journey and new program, and I've just loved it. My life motto isn't really a motto as far as that goes, but I would say in the past couple of years, I've really started to put myself at the same level as families who are going through this life journey alongside of me. So it's I see you, I hear you, and I am you.
I love that. I love that. It's very nice to meet you, Linnea. Thank you so much for sharing. Who wants to go next?
I can go next. My name's Kara. I'm in Billings, and I have a child that has special healthcare needs. I've been a peer supporter for 2 years. And I guess my mantra that I think in my head and try to live is be the change. If we need a change, be it.
I can go next. My name is Deborah Davis. I'm a family support specialist with Family Outreach. And I don't know if it's a life motto, but I think it's really important to treat everybody with respect.
Nice to meet you, Deborah and Kara.
I'm Amy Schaefer. I've been a peer support for almost 3 years. My life motto, every day is different.
It's good to see you again, Amy.
I'm also on the Family Peers for Hope board.
I can go next. Again, Beth Ayers. I did direct services for about 2.5 years. Now we are training family peer supporters, so that's been fun. Lately, my life motto is to breathe. That's just kind of been my word. Been a lot going on. So thanks, guys.
Hi there, I'm Jobina McCarthy. Oh, um, I am a peer supporter with Montana Family to Family in Missoula. I guess I've been doing this work since I lost my first preemie 30 years ago, and have just been generally supporting parents, connected with parents for that long. And I am now challenged to have a life motto. I have none. I appreciate this. Thanks, Leah.
Nice to meet you.
My name is Kayla Myers. I'm a family outreach coordinator at Family Peers for Hope. I don't do direct services anymore, but I did for 2 years. Life motto. I don't, that's a good question. I feel like it probably changes, right, in different seasons, but right now it's probably knowing I can't change the world and what's happening around me. So just trying to be like a reflection of what I want the world to look like around me.
That's excellent. It's so nice to be able to put a face with a name.
I know. I don't know. Google Meets, I think I turned like my settings were weird yesterday and I didn't want to get off and fix it. So Zoom works good for me.
My name is Jennifer Doney Dietrich. I'm in Missoula. I have been a family support specialist. April 4th will be 32 years. I used to work for the Child Development Center in Missoula, and it shut down 2024, the end of June. Sorry, it's still really hard for me. Obviously I don't have any children, but I would like to be able to support families more in a capacity, especially with the way our world is right now. There's so much need, there's so much craziness. I just be kind, everybody. Be gentle, be kind, lean on each other, be there for everybody. Yes, breathing would be good, those long, deep breaths, and just know that we're all amazing and it takes a lot of energy and a lot from us to help, but it's worth it, right? So we just got to keep that philosophy going, especially I'm tired. 32 years is a long time in direct services, but I'm always willing to learn more and see how I can help the whole entire team. It does take the village. So nice to meet everybody.
Thanks so much for sharing. And I'm not going to make anybody do it because I know that sometimes when you do direct service work, you've got a training on in the background or a webinar on in the background while you're doing other things. So I am going to go ahead and introduce myself. My family story really starts or really gets intense in October of 2022. And from October of 2022 through August of 2023, while my oldest stepdaughter was living with me and my husband, we ended up working with 3 different community behavioral health providers, 4 crisis stabilization units and local mobile response units, 2 separate police departments, the National Center for Missing and Exploited Children, and Ohio Internet Crimes Against Children. Our local Children's Advocacy Center was also an organization that we worked with. In total, my stepdaughter spent 122 days in crisis stabilization over those 10 months. She saw 16 days in juvenile detention, 6 months in residential psychiatric care. She had been charged 3 times with domestic violence, which were ultimately dismissed when she entered into residential psychiatric care, and we had 12 visits from child welfare. And now those are just the visits that came to our house. They did not include the visits that her mother had at her biological mother's house, but this is just what our life looked like for those 8 months. And throughout that experience, I and my husband and her bio mom all experienced very specific kinds of trauma around raising her and being involved in all of these systems where no one talked to each other and everybody said something different, and every organization had policies and procedures that excommunicated themselves from working with their communities. And that led me ultimately to get my family peer support certification, and I've been doing family peer support, or I've been certified to do family peer support for going on 3 years. I don't do direct support anymore. I work again in the back end of nonprofit organizations. But this piece of my history and my family's history has never really softened in my memory. And when I started doing direct support, I wanted to start collecting information around that caregiving experience for multi-systemic youth, which is what we call it in Ohio. And that is defined by involvement with 2 or more of the systems of care. So juvenile justice, child welfare, mental and behavioral health, school disciplinary and truancy track. And there's 2 more that I can't remember off the top of my head. But I wanted to start collecting that data because nobody was. And I wanted to really highlight the experience of living through it, especially as I started to learn more and more about behavioral health and mental health and build my skills and knowledge base around providing direct service. There are a handful of things that Traces is really meant to highlight. One of those being child-to-parent violence, which is physical, verbal, and emotional abuse from a child to a parent or caregiver. In the research that I've done, we see verbal and emotional abuse in up to 91% of cases involving multi-systems youth, and physical violence from child to parent between 5 and 21% of the time. There's a lot of emotional degradation and public stigma, the systemic fragmentation across the systems of care, financial instability from caregiving related job loss, job changes, reduction in hours, and then the institutional betrayals that come from going to a system or to a professional and saying, please, for the love of all that is holy, I need someone to help me, and then having to do the hurry up and wait, and everything runs so slowly. And in any other kind of relationship, right? Whether it's intimate partner relationships, whether it's familial relationships, friendships, employer-employee relationships, these kinds of things are labeled as toxic environments or toxic relationships. They're highlighted as abuse. But when it comes to caregiving environments, we don't have that kind of language to help us denote and explain our stories in ways that legislators and non-family support professionals can understand, which makes it hard to advocate on our behalf and on behalf of the families that we serve. So Traces it reframes the caregiving experience as high impact trauma exposure point. So it breaks it down into caregiver strain, trauma activation, systemic overwhelm, and relational rupture. Traces specifically is a screening and assessment tool, and it is a descriptive tool set for family supporting professionals to use to expand the way they think about the caregiving experience, to guide their conversations with families, and to encourage connections to resources that may have previously been dismissed for a family, or maybe a family didn't qualify for before. And it's made to connect with the way that your organization already works, not to prescribe specific acts, policies, or processes. And this is a new slide, and I've added it with the intention that as Traces starts to gain traction, organizations will start to implement it in a variety of different ways, and it is designed to do that and to be used in that way. So when I started doing the research into multisystemic youth caregiving and complex medical and behavioral health youth caregiving, I started to see a lot of the parallels between adverse childhood experiences and what I was experiencing and what my families were experiencing in their caregiving capacities. So I'm sure the majority of you are aware of or have some understanding of the adverse childhood experiences, the ACEs screening. And it completely changed the way that we talk about childhood trauma, because it lays out very consistent points in a child's life where they are that specific experience across race and gender and ethnicity and income, in any demographics. Those specific instances are still labeled as traumatic, and they still have specific and long-lasting impact on the child. Now, there are very few, if any, that I can think of off the top of my head, ACEs that don't have an equal and opposite caregiver experience. And my favorite way to illustrate this is that we acknowledge the childhood experience of having a parent incarcerated as trauma, but we don't say that when a child is incarcerated. And this is particularly true and particularly traumatic when you are the one that is calling the police. And they show up, and you know that it is your phone call that led to the incarceration of your child. Same thing with substance use in the household. Yes, it is absolutely traumatic for a parent to be a substance user. It is also traumatic to have a child that is a substance user, right? So seeing those parallels helped me to really conceptualize what I was experiencing, and then personally to allow myself the ability to call it trauma, because up until I was already a certified peer supporter and well into the research on this, no one had said that to me. So Traces captures information around 6 domains: the parent to child impact, the spousal and nuclear family impact, the extended family and the social and community impact, financial strain, and household safety. And the way I want you to think about this is as a ripple effect, right? It starts with the tightest relationship that we can possibly capture data around, and that is the relationship between parent or caregiver and child. And then it moves outward from there, and you go from 2 to 3 or 4 people. That's the nuclear household. And then it expands into their community, and the financial strain and the household safety get stacked on top of that stress. These are external forces coming into the household and into the experience of caregiving. There are 2 versions or 2 tools in the tool set. One of them is a screener assessment, and it is 12 statements. There are 2 for each domain. And Answers to those are yes, no, and not applicable. There is also a full assessment that has 72 questions across the 6 domains, which is 12 per each, and they are scored on a 0 to 4 Likert scale. For both the screening tool and the assessment tool, you'll capture some very general information. And then making sure to document which systems of care your family is involved with can help you start to see where the intersectionality lies in these families in ways that allow you to advocate on their behalf to a supervisor or a program or to advocate to like legislatures or upper management. But this is what the traces screener looks like. And the statements are set up just like this. Every time you do the screener, it'll look like this, and it is yes, no, and not applicable. Why using a binary yes and no or not applicable is not more effective. I don't want to say that. Is effective in this specific circumstance is because when we are working with families who are involved with multiple systems of care or multiple government controlled systems, grant funded, whatever, right? A lot of the times they are in moments of crisis or they are managing multiple versions of trying to get the right people to say the right thing to get care for their kiddo. And it is stressful and it is traumatic and it feels like you're drowning. And in order to make the 12 statement screener accessible, this binary system allows it to be less emotionally demanding. I can say, yes, I'm experiencing this thing, or no, I'm not experiencing this thing, or I don't have a spouse, or my child is an only child and that doesn't apply to me. For the screener and the full assessment, there are 4 activation levels. So there is stable with strain, systemic tension, trauma activation present, and crisis embedded in care. For the screener specifically, if either one of the household safety statements are flagged as a yes, it should flag a safety protocol. And depending on what your organization does, sometimes that can trigger things like safety planning or a wraparound meeting or a meeting with your supervisor on how do we help this family to feel safe in their own home. The full assessment is set up like this. And this is just the example from the household safety section, but they are set up this way. And it is set up on a Likert scale rather than on that binary in order for us to see the degrees of strain and how it changes over time. It gives us a much more granular look at the caregiving experience for this family. So when I used this when I was doing direct service, I would tell people that it's like a 0%, 25%, 50%, and 100% of the time. That's that 0 to 4 scale. So how often is it impacting you severely? Does it have major impact? Is it like the highest level of stress that you currently have? This also allows us to get a much more detailed and nuanced understanding of a caregiver's situation where their voice and choice come forward, right? We might talk to them about something like financial strain, and to us, in our experience, that might look like, okay, well, we need to get them connected to Medicaid and EBT food stamps or SNAP, or I need to get them connected to a food pantry or a food bank, something in that that realm of creating financial safety for them. But really, they're concerned about their ability to afford the ongoing cost of having security cameras in their household, for instance. So helping to bring those topics forward so we know what we need to do and what ways we can provide intervention and how we can have conversations that honor their voice and choice in connecting them with resources. The full assessment also has 4 levels of strain, and it mirrors the ones from the screening tool. But again, there are 72 statements. There are 12 in each domain, and so there can be a total of 288 points. In the full assessment, there are 5 safety domain overrides, and that is that my child threatens or is physically violent with me or others. Emergency situations at home are common and often poorly managed. I feel unprepared for handling emergencies or safety concerns. I'm constantly worried about the safety of other children in my home. And our home lacks necessary safety equipment or modifications for my child's safety needs. And again, that hopefully will prompt whatever kind of safety intervention your organization uses. Safety planning, conversation with a supervisor, wraparound, or connection to like a clinical provider, if that's something that is recommended. The screener is specifically used, or is meant to be used, when identifying where the strain is, and the full assessment is what degree of strain and where is it at. So is trauma activation present, and how severe is it? What I am seeing is that organizations will start using the screener as part of their intake and a part of their weekly, biweekly, or monthly meetings with their families to measure that longitudinal change. But the full assessment is there when you need to get deeper into what is actually going on. When I started working on traces, I was the only family peer supporter in my county. And I started having conversations with my supervisor around, I wanted to start collecting this data, and I thought it would be really useful, not just for like the advocacy portion of it, but also for grant management and securing funding and bringing on new family peer supporters. And she was like, I don't understand why this matters so much to you. She, fortunately or unfortunately, did not have the same life experience, did not have a multi-systemic kiddo. And when I talked to her about why it mattered so much to me, it became very clear that if we're not screening for it or we're not measuring it, we don't have data to accurately meet people where they are and to build interventions around the reality of living on the ground. When our caregivers are under strain and stress and trauma, their ability to act in their own best interest and their family's best interest gets diminished and washed out. And the systems that are put in place don't do as well at supporting them as they should. What we measure shapes what we fund, what we train for, and what we build interventions around. And that is why this matters. Traces becomes accountability for family peer or family supporting providers and organizations. It also starts to become accountability as we work our way up the chain into like child and family services and into the legislature and into the State Department and upwards, right? And then it becomes language and leadership and legislation, and it builds a system that helps to support caregivers in the reality of living in a traumatic situation in ways that we have not done it before. And that is traces. And I would love to, if you guys have questions or you have something you want to discuss specifically. I made sure to leave a good chunk of time because I know that it can be a lot all at once. So I wanted to leave room for discussion and intentional question time.
Yeah, Leah. So in the chat, Jennifer said, do we have access to the slides and will there be a training on how to implement the assessment?
So I can absolutely make the slides available. I'll send them to Beth and she can send them out on your guys' network. The way that I currently have Traces set up is as an open source tool. So you can go straight to the incubator.org website. You can find the facilitator guide, the screening tool, and the full assessment. They are right there and ready for you to download. And you can start to implement it in your practice whenever. If you're interested in becoming a data contributor and helping me to improve traces and helping me to collect information across the country on the caregiving experience, that is also something that is available. But you're welcome to just use it yourself if that's not something you're comfortable with, or you don't want to necessarily have a conversation with your organization around what that looks like in implementing a data contribution agreement. That's totally fine too. But it is available, and you're welcome to it. And my email is on the slides, and you're welcome to email me if you have questions, or if you start using it without data contribution and you're like, hey, I think it could benefit from this, or hey, my families are really thinking that this is helpful. Feel free to reach out to me by email.
Okay, could you reference again where I could find it? You talked too fast, so I couldn't hear where I could find you said open source tool, but then facilitator guide, but I don't. Oh, there you go, right there. Are therapists using this?
No, Traces is not meant to be a clinical tool. It
Okay.
is very specifically made for non-clinical family support professionals. So family peer supporters, wraparound case coordinators, case managers, maybe. I haven't had anybody from case management show interest in it, but there is a lot of like skill and job description overlap there. So that may be something that happens in the future, but it is very specifically not made to be used by clinicians.
Okay, that's good to know. I have a family right now that I'm thinking I might want to use this and maybe I'll be reaching out to you. I'll just put it that way for some support. Yeah, and how this crosses over with the pyramid model and Cephal, those references is with those social emotional tools. Does that make sense what I'm saying?
I think so. What I'm hearing is that Traces intersects with those models of social emotional engagement.
Okay. Thank you very much.
So I would add a plug for there's already one program that is doing a pilot project around this here in Montana. And Family Peers for Hope is just helping, or I don't know what we're doing. We get the data. So we are privileged enough, thankfully, to get the data. And our hope is to use it for legislation, for family peer support funding, for Medicaid reimbursement of family peer supporters. And so I would really encourage you, if you want to have this screening implemented in your program or your organization, to do the data collection and data contributor, so that we, as the boots on the ground in Montana, have that information to really raise the education awareness around caregiver trauma, and really be able to put some funding towards family peer support. So that's my little plug for the data in Montana.
I think it's pretty neat. I adopted my granddaughter with autism, and I didn't know what I was in for. I got to tell you, we made it through though, and she's doing well as an adult. But I got to tell you that something like this would have been a great tool to maybe get help for us, one, especially during that teenage part. That was pretty rough. So
I will drop the link to the Traces open source tool in the
Are there other questions for Leah?
So how many agencies right now are utilizing this? Are being able to help you gather the data? Is there, where are you seeing the most support?
So right now, I'm partnered with Family Peers for Hope, and I'm partnered with St. John's United Cares wraparound program. I'm also getting ready to onboard one of our NAMI programs in Ohio, and then I'll do something very similar to this after I get NAMI's training done for their family peer support network, and in order to bring on more people to pilot it. This is round 1 of piloting, and my hope is that this will be right now the pilot is for 6 months. I'm hoping that it will turn into a year, and I will continue to add organizations into the pilot. I'll be able to add on individual family peer supporters as well into the pilot, so that way I'm getting a lot of broad data around the actual tool implementation and what is helpful and what is less so helpful. And this is, again, it's a descriptive tool. It will continue to grow and change as we hone in on what data really needs to be collected.
Amazing job, by the way. Much needed.
Thank you.
Good job.
Are there any other questions?
I have a question. You can't see me, my camera. I don't know what I did when I logged on, but going back to your questions, I'm wondering, is there a question about sleep and sleep deprivation? Because that is a huge issue that I hear with a lot of families, because that's a safety issue as well. If families aren't allowed to sleep just due to behaviors and diagnoses, I'm just wondering if that isn't something that you want to include in your questions.
That is not currently included in the current iteration of Traces, but I love that idea, and it makes a lot of sense to include that. And maybe that's something at the end of the 6-month pilot, we go back and say, we do see a lot of families that are struggling with sleep. It should be added to the screener and to the assessment. I love that suggestion. Thank you so much.
You're welcome. So, I didn't do my introduction. I did a little bit on the in the chat, but I was a caregiver for my son for 16 years. And so being on the back end of it, knowing like what it was that I struggled with, that's why I'm always wondering, okay, these are the things they're struggling with. And I love these assessments, and I love like going back and saying, okay, because that's how kind of I write my IFSPs. It's like, what is keeping you up at night?
Yep.
So I love these tools, and I love the idea of advocating and going back to say, hey, this is how we can support these families. We need to get some more funding to support the caregivers that are in our state. So thank you for all the information and what you're doing.
I just wanted to say something. I feel like since obviously like law enforcement and other organizations are going to be involved in this scenarios, right? Like it could be law enforcement, it could be all kinds of different things. I hope that like the long-term hope would be if this does get implemented in some different states, that when they were to like look up this kid, for instance, here's an example. Say a male 12-year-old autistic boy cannot handle his feelings and someone, not his family, calls the police, right? Absolutely a scenario that could happen tomorrow, if not happening right now. What would be amazing is if this program was in place that was in the file to say, look, this isn't like take the kid away, like, because again, like, we're people on the outside looking in that don't know what's happening at home, don't have the skills, nor are we fully on board that those first responders have the skills, right, to navigate that. So what would be amazing is if this program went into place, this was in the file, like, look, this is just something that's navigated. The police get called, they're like, oh, whoa, look, like, we've got this in the system. They're like, the family's navigating all these things. Because again, like, the 12-year-old could just be having, a meltdown. Not everyone likes that word. I'm not sure if I like it all the time, but like a meltdown, right? But the neighbor walking by is like, I think I should call 911. And now we have like a whole nightmare that just shouldn't be happening, right? Because they don't know what's happening. But what I'm thinking is if this got into place, this would be like a game changer for families. They're like, no, 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 no. Like, we're navigating a system. We have all these people. We're in therapy. We're doing all these things. Because again, like, we're also navigating, first responders that don't have all this training, and it could be all kinds of different first responders, not just the police. Like, you know what I'm saying? So I think that this could be a tool to then pitch to all these organizations to be like, if you see this, if you search this zip code and you know what I'm saying? Like, that would be amazing, because I'm so utterly terrified for what the future brings for my family. Absolutely.
100%. And I do see the hope is that long term, the data that gets collected through not just the pilot, but that ongoing longitudinal, because I'll never stop. Traces will never stop being something I'm passionate about because I've lived it, right? And bringing the data not just to the funders and the policymakers, but going to the first responders and saying, look, in where I live in Stark County, I've had conversations with many first responders in my county. We are seeing a wild increase in child to parent violence. We are seeing a wild increase in like teenage non-suicidal self-injury. How do we document these things so that everyone knows what's going on? It then starts to become a conversation around building actual community, bringing first responders and therapists and case managers and clinicians into community with each other to become the village that helps that child and that family heal and move forward in their journey.
I just want to point out the part that had really hit me when I first heard this presentation was the fact that the caregivers, the parents, are the ones upholding systems. And if a caregiver or parent, due to trauma and stress and strain, can't continue, there's nobody else in the systems that uphold that child. If the parents can't do the treatments and the planning and the coordinating and the appointments, there isn't anybody else that will do it. And that's when kids end up in foster care and so really helping the systems and the providers understand that the child's care is really dependent on the parent and the caregiver's health and, taking care of them. And so, yeah, I just hadn't ever thought of that kind of broad picture before.
The other thing I will say too, and I haven't added it to this version of the Traces presentation, but Traces is very specifically a deficit-based tool. I know that most people go, we only use strengths-based assessments, but deficit-based tools as a part of your toolkit allow not just allow, but give parents permission to just very much go, everything sucks right now, dude. Like, everything is terrible and no one wants to help me. And to sit in that ick and that gross, sticky, everything feels like it's falling apart and you're trying to duct tape it back together. Sitting in that feeling with families that we're working with is such an integral part of being a family support professional of any variety. And until that part gets integrated into the work purposefully and intentionally, parents don't feel like they have the right to say it sucks or they have a right to say that it's traumatic. So bringing that kind of language back into conversation, especially when you've got people who have been doing it for a very long time or have like an extended period of intense multi-intervention it, like, you get to a point where everyone's telling you you're doing such a good job and you're doing everything right. And it's like, I know that. I know I'm doing everything I'm supposed to be doing, but that doesn't make it suck any less. So, because I'm sure that it'll come up, especially if you're going to take it back to organizations or program heads or supervisors to have conversations around implementing traces. I know that it'll come up in conversation. And it is a much bigger part of the implementation training that I do with organizations who do the data contribution agreement. So something to keep in mind. Do we have any other questions, comments,
I was
I,
gonna, oh,
concerns?
oh, sorry.
Hmm?
I just wanted to say it's very validating that you're doing this work from like a parent that has complex PTSD and that had to work through all of my stuff in the midst of my child's like abusing me, right? Like there's just like this component of just like I have to put all of my childhood abuse aside while someone and stay calm while someone else is abusing me. And it is such a complex situation and like not be triggered and just be like, that's you, that's not me. And like work through all that and with like no honoring from anyone, like no one honors that, no one says, oh wow, you're doing a great job, like I just got a gnaw on that, like I just got a nom, like do it myself, like no one's gonna help me, like the only person that like knows is like my therapist, you know what I'm saying, like she's just like yeah, but like also then remembering not everyone is like born with a silver spoon. Not everyone just has it so easily in life, just generally. Then you add on top of these complex things with your children, right? So, like, you're dealing with your stuff, no, I'm dealing with it. And then now I have like my child's, no, I'm dealing with it, right? Like, so you just have this like compacted stuff happening. And like, you have to be like, oh, I got all these feelings bubbling up today. Whose feelings are those? Are those mine or are those my daughter's? And like, and can I just say, like, from like dealing with professionals and like in the medical industry, can I just say, oh, BT Dubs professionals, there is no like handbook. And I do want to say this, like, let me could you perfect professional get your video camera because I want to see your perfection on a daily basis. Oh, yeah. And the ones that want to stand there with judgment, then they don't even have kids. I'm like, so you don't even have a kid. You don't even have a kid with complex needs. And you're going to sit there with like judgment. I'm like, for reals. So I want to say, like, it is a lot. Like, we are absolutely dealing with a lot, right? Like, and you are honoring it. You are in this situation where you are honoring all of us. And I so appreciate it. Thank you so much. Thank you.
Thank you so much for sharing that and your experience. And I want you to know that, when you build tools or you start a program or whatever, you do this very pie in the sky thing and you dream really, really big, right? And as you start to like brush away the stuff that you're like, you got to do it one step at a time. One of the things that I'm really hoping comes out of Trace's implementation is connection to non-clinical, non-formal family support systems. Because when you have a parent that is going through this very complex period of time, both in their life, first of all, as you know, this is their first time being a parent of a complex youth. They don't know what they're doing all the time, but also it's not always appropriate to refer to a clinician. Sometimes it's not a clinical intervention. Sometimes it's not even talk therapy, right? We need friends and we need community supports. And it makes sense to sometimes say, you know what? I know a church, they've got a knitting group. They meet on Thursday mornings or Thursday afternoons when kiddo is at school. Do you want me to get you connected to them? So you start rebuilding the muscle in the community, right? And the ripple effects of traces goes so far beyond just capturing the data. And I hope that comes through when I talk to you about it, because traces in and of itself as a tool is very data based, right? I want to know, the intersectionality and how that manifests in our families and our parenting experience. But I also want you, right, Amy, building back the village. I want, when you implement it, I want you to take it and do a community environmental evaluation and say, where can I send my families that they wouldn't typically think of, and I wouldn't typically think of, and my supervisor who's been doing this for 25 years, who only ever believes in clinical intervention, which is still equally important when it is valid and referral based and etc., right? But really starting to build back the round portion of what it means to be in community with each other. And that is the radial benefit of looking at the trauma and the stress and the strain and the complexity of managing a household that feels like it's been set on fire.
I'll just read some of the chat, talking about, continuity of care and non-judgment, and that not saying it makes it worse. Absolutely. Any other questions for Leah? Or comments or anything?
Yeah, I think just a statement I think is appropriate here because I'm in that where I was a caregiver and now I support those that are caring for kiddos with complex needs. It's just that I think it was one in the beginning, somebody's motto was about being seen and heard. I think that's just so important. And I think even just because everybody has that basic need, right? To be seen, to be heard, to be acknowledged. And I think that is so important. Um, so yeah, thank you for this presentation. I appreciated every piece of it. So thank you so much.
Please feel free, as you guys take traces and use it with your families or take it to your organizations or your supervisors, feel free to reach out to me if they have if you have questions, if they have questions, if they're interested in implement, please. I am here. I do this work because I love it, not because I get paid to do it. So I plug in as much and as many opportunities to talk about traces with people as I possibly can, because it's a passion project. And thank you guys so much for spending some time with me today and listening to me talk about how to capture data around just absolutely terrible things that our families are going through. And thank you so much for the work that you are doing. As a person who received family peer support and family support professionals, like during that period of my life and my family's experience, it was so integral to the success of my family. So as you go out into the community, remember that even though you might not see it, the work you're doing is absolutely making a difference. and you are inspiring people to go out and do their best for other people. I'm actually one of the NAMI people that I'm currently talking to in Ohio was my direct family peer supporter. So you will see that start to come back. What you put out into the world comes back to you tenfold. So thank you so much for honoring families like mine and the work that you do.
Thank you so much, Leah. Thank you for being here and sharing you and your story and your passion and your tools. Yeah, thank you so much. This has been a great, wonderful hour. I appreciate it. Thank you guys all for being here. I echo what Leah said about just, continuing to do the good work out there for families. And hopefully we will see you all next month at our March Family First Wednesday. Thanks again, Leah.
Thanks, Beth. Have a good day, guys.